In this video, we'll be talking about preparing for pathophysiology, pre-nursing strategies for pathophysiology. So this is on the pre-nursing level. When you think about pathophysiology, you think about altered anatomy, altered physiology, okay? So the structural function is what you focus on with anatomy. And so the body is, the structural functions not working properly. The physiology deals with the cellular function of the body, okay? In order for organs and body systems to work properly, we think about the physiology, we think of the cellular structures, okay? So when we think about pathophysiology, we think about altered anatomy, altered physiology. So as a pre-nursing student, you have to make sure you do well in anatomy and you do well in physiology and have this basic foundation so that when you move into pathophysiology, you will have a smooth transition. Nonetheless, if you have had difficulty with anatomy and difficulty with physiology, know that you can always review and get up to speed, okay? Now, so we're going to be looking at preparing for pathophysiology. So again, altered anatomy, altered physiology when we focus on pathophysiology. So number one, you have to know how the human body works normally, okay? So in terms of the heart, we're going to use the cardiac system as an example. We're also going to use a cardiac disorder in order to focus on what we need to know. So number one, you always do an anatomy review of that structure. So in this example, we're going to be using the heart as an example for our focus, okay? So when we think of the heart, we think of the structural functions of the heart, and we think of the physiological functions of the heart, okay? Now, when we think of pathophysiology, there are several elements that we have to focus on. Your first step as a nursing student is to define the definition of the disease state, okay? So you have to define the disease state. The next step is we'll look at the etiology, that is the cause, and we're going to break that down. We look at the pathogenesis. These are the steps in the alteration of the body system, okay? How does it occur, right? The natural history, all the different steps. Then we're going to look at the clinical manifestations. What are the signs and symptoms? What do we find on examination? And what are the symptoms that the patient reports? At-risk population, who gets this disease, and then management of care. You notice when we look at pathophysiology and we look at all of these things, we are focused on the management of care as the last part of the scene. Okay. Now, so we're using valvular heart disease as our example, okay? So a definition, a simple definition of valvular heart disease is disruption in the unilateral, unidirectional blood flow through the chambers of the heart. And description is spelled wrong, so I apologize for that. So valvular heart disease is disruption in the unilateral blood flow through the chambers of the heart. Now, when we look at valvular disease and we're starting with pathophysiology, again, we have our description of what it is, and now let's look at the etiology. When we think of etiology, we think of the cause. Etiology could be intrinsic, extrinsic, idiopathic. So when we think of extrinsic causes, right? Intrinsic causes, right? We're thinking about inside the body, right? Extrinsic, outside the body, and idiopathic, we don't know the cause of it. more like the idiots don't know the cause, right? So that's an easy way to remember that. Now, when you think of etiology, you're going to think about all of these things here, right? So it could be inherited, it could be congenital, metabolic, degenerative, neoplastic, immunologic, nutritional deficiency, iatrogenic, okay? And that simply means that these disorders or whatever the disease is was caused by people in the healthcare system. Yeah, sometimes we make our patients ill, all right, based on our interventions, all right? So we always want to limit that. It could be psychogenic, and then the other causes could be physical agents induced, right? So physical agents induced, so we're thinking about force, trauma, temperature, humidity, radiation, electricity, chemicals can be a cause of a disease, right? And also, we're also thinking about infectious agents, viruses, bacteria, protozoas, fungi, pathogenic animals, worms, insects, and as we know with the COVID-19 virus, right? That's an example of an etiology. What is the cause of the patient's illness? Okay, so in terms of valvular heart disease, right? The etiology focuses on a different focus, and the etiology for valvular heart disease is multifaceted, right? So it's congenital. Some children are born with valvular heart disease, right? It could be a minor thing, or it could be a major thing, and the pediatric patient may need cardiac surgery, right? It could be caused from trauma. It could be from ischemia, right? Damages to the heart from like a heart attack or what we say a myocardial infarction, right? Or it could be degenerative, as people get older, the valves in their heart don't work so well, right? As people age, this can happen. And inflammation, and one of the main causes of valvular heart disease is rheumatic heart disease, okay? So these are the common causes for valvular heart disease. So that's the etiology. So as a nursing student, when you understand the etiology, it helps you to begin to focus. Now, when we look at valvular heart disease, it's very important. Now we're going back to anatomy and physiology. So we're going back to the unidirectional blood flow of the heart. How does blood come into the heart and how does blood flow out of the heart, right? We know that blood comes in through the atria, right, and goes into the ventricles and then goes into the pulmonary system to be oxygenated and then out, right? So reviewing normal anatomy is very important. Now, when we look at valvular heart disease, in this instance, we're going to be focusing on mitral valve stenosis, right? And we look at what a normal valve looks like and we look what a narrowed valve looks like, okay? So that sort of like set the stage for your studying. Now, we're still on valvular heart disease as an example as we flow through pathophysiology. Now we're looking at the pathogenesis, right? These are the steps in how the disease develops, right? The natural history, the steps, the progression of the disease, right? So we know that heart valves determine the direction of blood flow through the heart, right? And normally they flow in one direction, right? It's unidirectional, one direction. Now, we know that with valvular heart defects, right? How do they occur? They occur because they exert their effects by obstructing blood flow, right, through stenosis, right, stenotic valve disorders, right, or allowing backflow of blood through regurgitant valve disorders, right? But in this case, we're going to focus on the stenosis, right? So we know this is how this develops, and we understand already the pathogenesis. We understand the etiology that can cause these problems. Now, so taking a step further, when we look at the pathogenesis of mitral valve prolapse, these are the steps. We have here in front of us 6 main steps, okay? So we are saying the first step is incompetent opening of mitral valve during diastole and with left atrial distension and impaired filling of the left ventricle, right? So we know that is step number 1, okay? That's what happens with step number 1. Okay, now we know in step number 2, the mitral valve is then characterized by fibrous replacement of valvular tissue. So the tissue is being replaced by a fibrous component. And because of that fibrous component, there is stiffness and fusion of the valvular apparatus. Okay? So we know that's what's happening. Then when we go over here to step number 3, right? Step number 3, the mitral valve cusps, right, at the edge, and involvement of the chordae tendineae causes shortening. So now we know there's shortening. So things are not, the heart is not able to contract properly, okay? So the heart is not able to contract properly, and that's an issue. That's a big issue. So that's the third component. The fourth component is this shortening pulls the valvular structure more deeply into the ventricles. So now there's pulling, it's not contracting properly, right? And then when we look at step number 5, as this is occurring, there is resistance to flow through the valve, increases, and the atria becomes dilated, and the left atrial pressure increases. That is a big issue. That is a problem. Now, in step number 6, we see that the increase in the left atrial pressure eventually is transmitted now to the pulmonary venous system, causing pulmonary congestion, right? So now we fully understand the pathogenesis, and because we understand the pathogenesis, now we're going to understand the implications for the patient. Let's move on. Now, when we get to the next step, is now we're looking at the clinical manifestation. Whoa. So now we're getting excited about our studying. The clinical manifestation, we look at the signs and symptoms, right? We look for subjective data and objective data, okay? Now, when subjective is definitely what the patient reports, and objective is what we find on physical exam. All right? I'm not writing so good over there, but physical exam, right? That's where we find our objective data, right? Physical exam, diagnostic test, workup, right? The echocardiogram, right? Results, right? The EKG results, right? When you listen to the patient's heart, the abnormal heart sounds that you hear, right? The abnormal lung sounds that you hear, right? And fluid is backing up right into the lungs, into the pulmonary system. So as a result, this patient now have decreased cardiac output, decreased blood flow out to the body to perfuse major organs, right? The brain, right? The heart itself, there's decreased perfusion, okay? And to the kidneys, all these vital organs are not getting good perfusion. So we want to rest in decreased cardiac output. Now, when we look at the clinical manifestation even a little deeper, right, we begin to understand even more. The signs and symptoms, again, are subjective data. Always understand the classic things that the patient will report to you, and on objective data is what we will find on assessment. Now, mitral valve stenosis causes overall decreased cardiac output. So what are some of the things that's going to happen because of this decreased cardiac output? We're going to have pulmonary congestion, and because of the pulmonary congestion, we're going to have a thing we call nocturnal paroxysmal dyspnea, right? So this is when at nighttime, when the patient is at rest, right, the patient wake up, basically feel like they are difficulty breathing, they're drowning, right? They cannot breathe. They wake up at nighttime. These patients have orthopnea. So when they lay down in a flat position, they have difficulty breathing. These patients now have palpitations, right? They feel like their heart is racing. They have chest pain, okay? Weakness and fatigue. And we know the weakness and fatigue is because of the decreased cardiac output. Now, so you see how all these clinical manifestations are put together. The next thing we want to look at is who gets, so now we're looking at all of our clinical manifestation and everything. Who gets these? Who gets mitral valve stenosis? Who is at risk? And this is where our teaching comes into play as nurses, right? So those who have congenital defects and those with a history of rheumatic heart disease, okay? Those are the biggest population that get this disorder. Now, so then after we look at the risk population, now we move into management of care. And a lot of time, nursing students want to do management of care first, right? But look, we had to go through everything first, right? We had to go through the pathophysiology of mitral valve stenosis, right? We had to go through the etiology, the pathogenesis, the clinical manifestations, right? The risk factors, all that before we even get to management of care. When we look at management of care, there are several components. We have the medical management, we have the surgical management, right? And in this case, the patient is going to, depending on how severe the stenosis is, right? The patient will have medical management and or surgical management. Key medications, diuretics, right? These are medications that help to relieve congestion in the lungs, anticoagulants, right? All the blood that is pooling in the atria because of the valves are not able to work properly. The blood is sitting around, so the patient's at risk for stroke and blood clots, right? So they're on anticoagulants. They're on antibiotics because of the rheumatic heart disease, right? Which causes vegetation on the heart valves. So do you see how you put it all together? Diagnostic tests and management. What are the tests that the patient will go for? Echocardiogram. Nursing responsibility is teaching and preparing. Pre and post test preparation. All right. Now, as we go through the management of care, we can summarize how we prepare and study for pathophysiology, right? We look at the definition of disease, etiology, pathogenesis, clinical manifestation, risk population, and management of care. And that's how you focus as a student. Questions? Let me know. Make sure you like this video and subscribe and leave a comment. And also visit my page if you would like to have more information on different workshops that I offer. Thank you.